Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
I was there.
Okay, that we're right here now, and we're going to be Dr. Mencia. You always bring interesting people, but I think you really
only the best.
You did a super one today. Why don't you tell us who Dr. Robert Kagan is?
Yeah, Dr. Arias and Dr. Kagan and I go back almost 20 years.
No
We've been
kidding.
working together,
Yeah.
and he had been in the community longer than that.
Well, I moved here in 1977 to come to Holy Cross Hospital to be in charge of the Department of Nuclear Medicine and Laboratories. Because I came to Fort Lauderdale because I was board certified in two fields, pathology and nuclear medicine and radiology. And so I needed to go to a place where I could do both. So it had to be a big enough place that had both, but a small enough place that I didn't have to just do one of them, you see. So Fort Lauderdale fit the bill perfectly, having a population at that time of about 1 million altogether throughout Broward
But that was
County.
pretty new stuff when you first came. Nuclear
Yes,
medicine.
nuclear medicine is one of the newest specialties in medicine. You know, it grew up out of the atomic energy experiments in World War II. Peaceful uses for radioisotopes started with medicine. After that, the first one was the thyroid gland. People are pretty familiar with both diagnosing and treating thyroid diseases is by nuclear medicine techniques. And then there were radiopharmaceuticals developed through the 1950s and 60s that would go to different organs, and special cameras would take pictures. So there was a scan called a liver scan, brain scans, bone scans. People are familiar with all these different scans.
Mm-hmm.
But a big breakthrough took place in the 1970s, late 1970s, with something called nuclear magnetic resonance, which is called MRI today. See, people get nervous when they hear the word nuclear.
Yeah.
So this is
They
kind
never said that anymore.
this is kind of like the nuclear family, though. It's not a group of radioactive people that live together. It's a central cohesive unit. So the nuclear stands for the nucleus of the atom, the center of the atom. There is no radiation exposure with this technique. We're detecting radio waves that come out of the center of the atom, which is called the nucleus. And it relies on the interaction between these radio waves, magnetism, and the atoms that make up your body to create the most detailed images we have in medicine today. It's literally a living autopsy. You get up and walk away. But the detail we see is actually greater than you could actually see with an autopsy, to tell you the truth.
And the evolution of an MRI, now you have a three-dimensional where you can take a heart and basically rotate it in the image. It's amazing.
Well, the advances have been tremendous. Don't forget, MRI, there was no MRI before April 1st, 1984.
Is
On
that
April 1st,
right?
1984, the FDA approved the first MRI, and we had it. So the only MRI in Florida was the one that I had.
Wow.
That was approved by the FDA on April 1st, 1984. Now, we were doing it before that, but it was research. It was considered to be experimental. But on April 1st, 1984, you could actually charge, the Medicare didn't approve it for another 2 years, I want you to know. And that's when really it broke open and people started. But at one time, I had the only FDA-approved MRI center in the state of Florida. We did all the MRIs for the whole state of Florida.
It's pretty exciting. Well, let's go back to our listening audience. So I want to stay healthy, right?
No.
Are there special tests or things that I can come to you that you would do so that I would know about that plaque and the other things you were talking about?
Yes, it started out, don't forget, the imaging we started doing, and we still do today, most of it is when people have a problem, a significant symptom. And your doctor, takes something simple like neck pain, and he's not sure whether it's due to muscle spasm or just a plain sprain or strain, and he thinks maybe there's really a structural abnormality, like a herniated disc, for example, or something pinching a nerve root. He's going to send you for a scan. Now, the ultimate scan for that is probably an MRI scan of the cervical spine, because they usually would do an X-ray first, usually in your doctor's office. Dr. Mencia has X-ray in his office. But if that doesn't solve the problem, he needs advanced imaging. So the only thing we don't do at our center is plain X-ray. Okay, we do CAT scans, MRI scans, PET scans, ultrasound. So it started that way, where you'd come because you had a symptom, okay, and you needed to know what's causing that symptom. But then I came to realize over the course of many years that people had the problem long before they had the symptoms. Mm-hmm. The symptoms is near the end when you have symptoms, when you have...
And when you're talking about preventive medicine...
There you go.
That's when you come in.
When there's blood in your urine because you have a tumor in your kidney,
that's
you
not
had
prevention.
That tumor for 2 years sometimes before that, and it was just growing, and it didn't penetrate into the tissue enough to cause bleeding. Same thing with the lung. By the time you're coughing up blood or losing 20 pounds and you're not on a diet, it's late in the game. That lung tumor could have been there for a year or 2 years sometimes. They sit there and they're dormant. So that's when I started thinking, about doing these body scans. This was back in the late 1980s, and the only modality available, and actually it came out at that time, was the first 16-slice CT scan. With a 16-slice CT scan, you could do the whole body in one breath hold. It would take 30 seconds to scan your entire body. Now, of course, today we have, the newest CT scan I have is a 128-slice CT scan. That means it does 128 slices in one rotation. I can do the entire body in less than 10 seconds now.
Wow.
But the thing is, you have to do it in one breath hold because you can't have any motion. So you hold your breath and boom. So when we started doing these whole body scans using CT, now CT is an X-ray. It's a very sophisticated X-ray, but it's X-ray. And you have to understand that X-ray is based on differential density of tissue. So in other words, it's really great for the most dense tissue in the body, bone, and the least dense tissue in the body is air, and your lungs are filled with air. So for looking at your lungs and looking at your bones, you can't beat X-ray, and you certainly can't beat a CT scan, which is a couple thousand times the resolution of an X-ray. But everything else, there's only a 5% difference in density between muscle and organs and every other tissue. So they look pretty similar in grayscale. So you can have a tumor sitting in your liver as big as a grapefruit, and you won't see it on the most sophisticated CAT scan if it has the exact same density as your liver. But you'll always see it on an MRI scan because tumor's not liver. They're different. And MRI visualizes tissue based on its biochemical structure. Every tissue has its own unique biochemical structure, but every tissue doesn't have a unique density. See, density is a physical characteristic. MRI is looking for biochemical differences. So MRI is becoming the most definitive study for almost everything in the body except for anything to do with bone or air. So you still need CT scans, certainly for the spine, and of course it's simple for looking at any kind of bone problem, or even for your lungs, which are filled with air.
Now, a lot of patients, and in my show, The Wonderful Well Awareness, we talk about educating and empowering the patient to take charge of that preventive medicine you're talking about. You don't need a referral from a doctor to come to your center.
No, I'm the doctor, at the center.
Right.
And it's a wake-up call. It's a major wake-up call for me. I did my whole body scan, years ago. By the way, we have switched to doing them by MRI now, mostly, except for the chest, because the heart is beating. And the MRI is too slow to freeze the motion of the beating heart. So that's why you need that CT scan, because in half a second, boom, it does the whole heart, so it freezes it, so you can see the coronary arteries.
Stop beating for a second.
And then one year I did it, and there was this plaque. There was calcium in my coronary artery. Yeah, I used to weigh 225 pounds. Now I weigh 185. I didn't really work out. Now I work out 4 times a week, and then I monitored my blood. I looked at all the risk factors for causing coronary artery disease because I knew I had the disease, but nobody else knew I had the disease. You see, this is not a test that you would want on your record necessarily.
So exactly.
Because just having a little bit of plaque in your arteries is not going to cause a problem. The artery is going to be wide open because it's in the wall of the artery. But if it keeps building up, that's when it can become a problem. It can cause a blockage. Most people find out they have coronary artery disease when they have chest pain, they have angina, or they have a heart attack, right?
Yeah.
That's when they find out because there is no other test. I mean, a stress test is only looking for a blockage, and you want to find out long before you have a blockage. So those are the kind of tests we can do preventively, And then you have a wake-up call, and you start doing to slow this process down, because atherosclerosis is a process. And there are risk factors, which Dr. Mencia knows quite well, being overweight, having diabetes that isn't treated properly, having high blood pressure that's not being treated properly. Then you look at your lipoprotein profile, certain cholesterol levels, LDL cholesterol. That becomes significant. It's not significant if you don't have the disease. You see, otherwise it's just a number. I see a lot of patients, they're put on a cholesterol medicine just because they have a high cholesterol. But if you don't have any plaque in your arteries, there's no reason to be put on a cholesterol. That cholesterol could be helping you. Exactly. I had a guy with a cholesterol of 800. His blood, we took his blood, it looked like milk. It wasn't red, it was white. There was so much fat in his blood, and I said, we better look at your heart. I looked at his heart, it was perfect. There was nothing in his arteries. I said, don't let anybody put you on any of these statin drugs to lower your cholesterol, which a lot of doctors would do because they treat a number. You never treat a number.
And
you
that's
treat
why,
a disease.
Exactly. That's what people don't understand. And, we get a lot of the students. I teach for basically all of the university in South Florida, a lot of the nurse practitioner and Nova University medical students, they rotate with us at the center. And one of the things that I make sure they live when they do my rotation, that they learn that you have to tighten your belt and take charge of your patient care if you are the primary care physician. Because a lot of primary care physicians, they become like a secretary. And they say, well, let's see what the cardiologists have to say. Well, let me enlighten you. The cardiologists want that artery to be at least 50% occluded so that we can move forward and do a lot of things in your heart. But that time, you're talking about too close or already having symptoms. If you're going to talk preventive medicine, we don't want to wait for 20% occluded. So when you go to Dr. Kagan and you do the test and we look at the heart and we can magnify and look artery by artery to make sure that they are clean, if there is no occlusion, there is no need. I have a patient that is come from out of the country to get seen. And he got put on Lipitor 80 milligram. And he was killing his liver.
It might not have been necessary. No. Right, it wasn't necessary.
It was not necessary. So we did the breakdown of the cholesterol, and we say this is, when you look at the LDL, you have the LDL, bad LDL, and the not so bad LDL. You have the good LDL. When you look at your HDL, which is your good cholesterol, you are loaded with good HDL. So we broke it down for that patient, and it was hard for him because he said, that cardiologist just put me. He looked at the number and he put me on that, and he's a cardiologist. I said, well, you can listen to me, or I can send you to 2 or 3 more cardiologists to get 2 or 3 more opinions. But no, I don't care if you're a cardiologist or a neurologist. Not a lot of people are into preventive medicine. When we go into those specialties, then we are there to treat disease. You don't go to a neurologist and say, I am here to prevent a stroke. I am here to prevent a seizure disorder. No, you go there when you already have one.
Right, when you have it. See, Dr. Mencia can send me a patient. See, there's a big difference between structure and function, because you can have, a blockage of your artery of 90%. I mean, I had patients with blockages of all 3 coronary arteries of 99%, and they run marathon races. Now, if you go to an interventional cardiologist, they're going to want to put a stent in. You can't help that person. How are you going to help that person? He can run a marathon race. I don't care how the oxygen gets to the myocardium, as long as it gets there through tributaries, branches. It's a slow process that takes place over years. So we do a study called the myocardial perfusion imaging, which is a PET scan. It's the most advanced study that there is. Let's say I did a study and you had a lot of plaque. We were worried that maybe you had a functionally significant. Instead of doing a catheterization or an angiography to look for a blockage, it's more important to see if, in fact, that amount of plaque is causing any ischemia. Because if I do that myocardial perfusion test with stress and you're getting oxygen to all parts of the myocardium, you don't need to go to a cardiologist. It's treated medically. Right. All you need is medical treatment, and Dr. Mencia can treat it without seeing your cardiologist. On the other hand, if it turned out that there was part of your heart muscle was not getting enough oxygen during stress, then you have a physiologically significant lesion, and you do have coronary artery disease that might benefit from a more aggressive approach, like a stent or an angioplasty. So that's
It's amazing. I'm sitting here with my mouth open. How come you haven't brought Dr. Kagan here before?
We're gonna get his
Shame
phone number
on you.
because people should.
Oh my
people
gosh,
can
this
call
is the
directly
missing
and come and
link
see him.
in your practice. I've never heard of
It
him.
is, and you know
the things we find.
When we talk about prevention, I tell the patient it's like if you have your house and you have an irrigation system, you turn it on and you say, "Oh, it's working," but you can also look at your plants. If your plants are growing, it is working. So if you don't have what area where the grass is turning brown, then your irrigation system, and that's what Dr. Kagan is talking about. And the beauty is when people come there, they can see Dr. Kagan. He's an MD, just like me. They can see him, and he will sit down with you and tell you what study would be the best. Because I give you an example. When you get a CAT scan of the brain, you are concerned about having mini stroke or having problem with your walking. So you get a CAT scan of the brain. Well, guess what? The CAT scan of the brain, and Dr. Kagan, you can elaborate on this, can see certain portion of the brain, but won't look at the bottom portion of the brain where the stern in and the cerebellum is. It's not looking at that. Well, an MRI will give us a much better image of the entire brain tissue. So you might go and say, "Oh, I heard about having a CAT scan from so-and-so, so I'm going to go and get one." That might not be the best test. So when you are there, you are not in a hospital. I mean, this place is like a spa.
I can't wait to go see it. Am I invited there? I want to go see it.
We have every test available, and that what I do is basically interface with treating physicians to see which is the best test for you. So, for example, a CAT scan of the brain is what you would have if you went to the emergency room and they thought you were having a stroke. It would be very useful for that because there's two types of strokes. There's a hemorrhagic stroke where it's a bleed, or there's a stroke because you have a blood clot and there's not getting enough blood to a certain area. And you need to know the difference between those two strokes, and a CAT scan can tell you that. But in terms of someone, for example, who's having severe headaches or having difficulty walking, almost for anything else, the MRI brain scan is the definitive test, not a CAT scan. Now, once you find something on an MRI brain scan, a CAT scan might be a good way to follow it because it's a lot cheaper and quicker. But in terms of discovering any kind of problem with the central nervous system, the brain, central nervous system includes the spine too, the MRI scan is the definitive test today. You wouldn't do a CT scan on an outpatient unless you were following something that's already been diagnosed. So a CT scan is an inpatient procedure now. It's an emergency room procedure. In terms of outpatient, the MRI brain scan has completely supplanted it because it's 20,000 times the resolution of the best CAT scan.
Now, Dr. Kagan, you hear sometimes MRI, MRA. What's the difference, and what do you obtain by doing one or the other one?
An MRA is an angiogram using MR. The big advantage, at least certainly at our center, is that it doesn't require any contrast injections because the contrast of just the normal flowing blood creates the angiogram. If you have a conventional angiogram, they have to give you iodinated contrast material, which people have reactions to. I mean, sometimes even death, okay? But there's a lot of reactions. It affects your kidneys. So to have an angiogram by an MRI is called an MRA. So you can look at the carotid arteries. It's a definitive test. So you might have an ultrasound test as a screening test, for example. Or even Dr. Mencia might just be listening to your carotids and he hears a hears a sound that you're not supposed to hear called a bruit. And he would send it to me for an ultrasound, which is a screening test. And the ultrasound would say, "Oh, I think there is plaque there, but it's not exact." So if it turned out there was significant plaque by ultrasound, then you would get an MRA. And that would replace a conventional angiogram. They can operate on the basis of an MRA, and there's no radiation, no injections, no contrast. That's the advantage of an MRA. So you can do an angiogram of the aorta, the renal arteries, the carotid arteries, the entire brain. We do the whole brain now. Or for people with peripheral vascular disease, claudication, where they're having pain in their legs and you want to know if it's vascular because they're not getting enough oxygen, blood supply. That angiogram is called a aortic angiogram with lower extremity runoff. All of this is done totally non-invasively. No radiation, no injections, no contrast. But you need a special scanner. You need a scanner like we have, a very powerful scanner. Otherwise, they do an MRA with contrast. So the advantage there. Yeah, we have bypassed that. The huge advantage of our MRI scanner is that there's no contrast necessary for any of these angiograms.
Dr. Mencia, now I've attended a lot of the Alzheimer's conferences, and now they are able to look at the brain, the Alzheimer's. And so are you doing a lot of that? I mean, I don't want to let you go today. I am glued to him because this is so exciting.
I don't want to let you go without talking only about Alzheimer's, but,
Let's talk about structure first. The MRI brain scan would be the definitive starting study. And we do something called quantitative morphometry, which is not just eyeballing it, because the earliest thing that happens with Alzheimer's disease is you get a loss of volume of cortex in a region of the brain called the hippocampal region. And we have a special scan that can actually quantitate the volume of the hippocampus and compare it with the volume of the ventricle. So if the hippocampal volume goes down, the ventricular volume goes up, because the ventricles expand when you have loss of brain. And there's a specific pattern for Alzheimer's disease. And then, of course, there are non-specific patterns. So let's say we do that, and that's a special study which very few places can do. Most people just look at it and they eyeball and they go, it looks like you have some atrophy. But they don't quantitate exactly where the atrophy is. So if that's suspicious for let's say Alzheimer's disease, or even another type of dementia, because there are other ones. There's frontotemporal dementia, which is Pick's disease. There's Lewy body dementia. There's vascular dementia, people having tiny little strokes. So the MRI scan will cone down to which type of dementia. And then there's something called a PET scan, which is even more advanced. Now you're looking at function.
Functional.
And with a PET scan, we're injecting fluorodeoxyglucose, it's called, okay? Because the brain loves glucose. The highest metabolizing organ of the heart too. But so when you have hypometabolism in certain areas of the brain, that'll tell you what kind of dementia you have. So again, when we do this FDG study on the brain and certain areas of the brain have statistically significant hypometabolism, we can actually make the diagnosis of what kind of dementia you have. So,
and that's so important because there are like 20 types of dementia. So that becomes important. Dementia is not one disease.
Right.
I know there are people out there with their pen and pencil. They keep talking about him, but you guys don't give his phone number. So his phone number, if you want to call, and you don't need a referral. You can just go and talk and look at the center. Just go and have a cup of coffee or drink some water there. 954-772-8000. 954-772-8000. I don't do it as well as Anita, but I'm getting there. I think 20
you're not
more,
supposed to do that.
20 more years.
Well, when you come in, and sometimes I find things that, I'm not the treating physician, I'm the diagnosing physician. So I'm going to send you to Dr. Mencia. I'm going to call him and go, listen, I've got a patient for you here. This guy has atherosclerotic disease and he's got hypertension, and I'm not going to be
That's
the one.
what I love about
I'm not going to be the one treating him.
Yeah, you're into prevention like we are.
Right,
So,
and then I send them out because I'm just a diagnostician.
So we're going to give you the direct number. Is that what we want to do?
The direct number.
No,
right.
we want to give you the address.
It's a direct number. That 772-8000 number is.
Okay, so it's easy. 954-772-8000. But he's located at 3122 East Commercial Boulevard. It's just near your center.
Right, he's my neighbor.
I can't believe that. This is fantastic.
Just before the bridge.
Well, I'm very excited to have this. We're running out of time.
And there's so much thing to talk with Dr. Kagan about, breast cancer, prostate cancer, so many things that we have not even touched on.
I'm booking you now for our next symposium, the Cure Symposium. We have too many. I can't push you in, but you're definitely someone on the cutting edge. So I don't know if it's October or November, but I'm going to get back to you.
All right. Well, we'll get to things like the MR mammogram, which is the ultimate mammogram.
We're going to,
or the MRI of the prostate gland.
Back again.
Which can, you don't need biopsies necessarily. A lot of times I find tumors, and a urologist will feel a tumor, and you'll have an MR of the prostate and say, there's a tumor there, but it's benign. Just leave it alone.
Yeah, exactly.
I love what I've been hearing here, this Dr. Mencia. You always find the best people. I don't know what you do. You must dream them up, but this is very exciting, Dr.
I
Kagan.
sculpture them.
We can't thank you enough, Dr. Robert Kagan, founder and medical director of MRI Scan and Imaging Center. And again, you can, if you have any questions, I'm interested in that whole body scan. That sounds good. 3122
And
East
Dr. Arias,
Commercial.
too.
Oh, yeah,
I
Dr.
am
Arias,
too.
right.
Oh,
yeah,
yeah.
right. We're all going to do this. The number there again is 954-772-8000. But make sure that you call Dr. Mencia. He's the star of the show here. We don't want to let him get outstarred, but it's 954-489-1345 for Dr. Mencia, the AGI Medical and Dental Centers. By the way, the next issue, April, we will be featuring his wonderful book on kidneys. Take care of your kidneys, and they'll take care of you. And so you've got to buy that book.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.